Australia, Indigenous people have the highest rate of poverty. Poverty amongst Aboriginal people began as a result of the stolen generation that occurred between 1920 and 1970. Australia was colonized, leading to the government policies forcibly removing the Indigenous people's children from their families. This traumatized and affected the Aboriginal people as individuals, families, and communities. Colonization introduced diseases into Australia that spread and killed half of the first Australians. Aboriginal people suffered and are still suffering from the traumatic events that occurred during the stolen generation era. Due to this, they are living their current lives based on history. 1 of 5 Indigenous people live in remote areas where there are no jobs and other life opportunities. There is a higher rate of unemployment and rates compared to non-Indigenous populations. They receive government pension or allowance as their main source of income, and they are overrepresented in the homelessness services. Aboriginal people's lifespan is 8 years earlier compared to non-Aboriginal Australians. They are also known to consume alcohol that exceeds lifetime risk as well as smoking. Aboriginal people's culture contributes to their poverty. They live their ritual life and spiritual life, which is the connection to the land. Today, in places like Northern Territory, they'll still practice their culture. They believe in kinship, the relationship to the people who they are, responsibilities regarding their environment and ceremony. They have polygamy, traditional, and promised marriages in their communities. Aboriginal people have always suffered from oppression and have been discriminated against. They are treated unfairly as a result of colonization and the stolen generation when the British people took control. The Aboriginal Protection Act 1869 is a policy that was established to control Aboriginal people's lives. This policy influenced the privilege and oppression of first Australians. Their jobs were taken from them and given to the white Australians, leaving them with nothing but poverty. Some of them are uneducated, unemployed, and indulge in substance and drug abuse in their communities. Government benefits have made them to see no need of working and attaining education. As a result of education, they live in poverty, which also leaves them exposed to extreme health problems such as cardiovascular disease as a result of drug and alcohol abuse, diabetes, chronic kidney disease, and mental illness. Culture also plays a major role in Aboriginal poverty. Some of them still live the ancient life they lived before colonization. They do not work and they live in homes crowdedly. 17 people sharing a 3-bedroom house, to be precise. This results in what is known as family visiting, where families visiting stay up for 2 weeks or more. Sorry business of mourning a death in a family that takes several days also results in overcrowding living, and this happens as a result of cultural events and some for holidays. Other reasons of overcrowding living includes choice of lifestyle, low income class, and not enough culturally appropriate houses. This leads to drinking, fighting, stress, and suicide. Poor mental health, lack of safety, poor hygiene, and diseases also can arise as a result of overcrowding living. The government handouts are doing more harm to the Aboriginal people. It may be one of the means to closing the gap, but could also be the cause of more poverty, as they know that they can still receive income from the government even without working. It is leading to no improvement to their lifestyle, education, and their health. Reducing the benefits to Aboriginal people may result in the positive result, as by doing so it will give them a chance to compete to have better opportunities in life. Improving their areas where they practice family gathering without living overcrowdedly, being at risk of their mental health diseases and suicide is important. Keeping them busy by making community groups that can educate them on the importance of health is a way of living, and also working is also important. Allowing job opportunities will give them a chance to improve their lifestyle by having enough money to rent or buy houses that will allow big family gatherings as well as education. In the future, in my practice as a social worker, it is important to understand the Aboriginal community, their history and their culture, so that I can be able to provide adequate service to them. It is also important to treat them as individuals and not as a community. I have to be non-judgmental and be an active listener. Building rapport is also important as it allows me to work with my client knowing who they really are and how I can assist them. Working with Aboriginal liaison officer will be another connection for them to access healthcare services, and multidisciplinary approach will help create a good professional practice.